this COVID-19 virus seriously. Unfortunately, it's still taking lives of individuals in the state of Alabama, and case numbers continue to rise in our community. But we're doing a good job as concerned citizens and taking responsibility. Today, I signed a health officer's order that is going to highly recommend that you wear face covering while doing retail operations, both as a consumer and as the retailer. So starting Friday morning at 8 a.m., highly recommend everybody in the community who is a retail consumer or a retail provider wear face covering. We do not want you to use valuable PPE, which is medically certified, unless your doctor has recommended it for you, but use whatever covering you have that can be a bandana, it can be homemade, you can have some fun with it. But again, when you get out of your car, walk into the retail operation, please cover your face to help protect others, to protect yourself. And all retailers, please have everybody in your facility wear a mask. Thank you very much, and I'll now turn it over to Dr. Murphy, who will give you the newest numbers and information regarding COVID-19 in Mobile and in the state of Alabama.
Right. Thank you, Dr. Eishold. I'm Rundy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. To give you our 2:30 live update, we're glad to be with you here again. We hit over 2 million cases of COVID-19 disease worldwide today. In the United States, just over 600,000 cases and nearly 25,000 reported deaths. In Alabama this morning, over 4,000 cases of disease and 116 or so deaths. Remember, that dashboard is updated in real time, so those numbers change frequently. And in Mobile County today, the dashboard showed 542 cases with 17 reported deaths and 12 who died from this illness. I just want to mention a couple of things about hospitalizations and death, or those most severe outcomes from people who have complications of COVID disease. So about 10% of our patients have been hospitalized at some point during their illness. And these are our most vulnerable community members, and that's why we're asking you to adhere to the stay-at-home order. And if you do have to go out, we strongly recommend wearing that mask, both by the retailers and by the consumers. But 10% of our cases being hospitalized means that 90% of people who have laboratory confirmed COVID disease either have mild symptoms or symptoms that can be managed at home. And that's a really good it's a good bit of news for our community out there. So we are concerned about those at highest risk, but we also want to recognize that for the overwhelming majority of people who get infected, you probably will be able to recover at home. So, and also our death rate, we've been getting some questions about the death rate, and it has started to stabilize around 2.5% of our cases end up dying with COVID disease. And this is very similar to what we're seeing in Jefferson County and other states and other geographic areas. But we do caution that we expect there to be some changes later this week in the way that deaths are classified. There's a national webinar tomorrow hosted by the Centers for Disease Control to talk to clinicians about marking a person who died as died with COVID or not, so that we can better compare across states and jurisdictions and all be counting the same way. Of course, to those of you that have lost family members, you know, these are not just cases and deaths that we're counting. These are dear loved ones and husbands and wives and fathers and grandparents, and we deeply regret that this disease has taken lives in our community. And again, just want to emphasize that no matter what vocabulary you use to stay at home, the gift or the opportunity or the privilege or the right to move about the community, it's important that you continue to use that face mask so that we can protect those most vulnerable individuals. So some questions from the media today. We have another speaker today who's going to give us some uplifting guidance, some ways to correct some nerves and jitters out there. But so I want to just answer a few media questions so that we can give Virginia some time to help us have some levity. So this question is to say that the number of tested is just over 2,700. How is that as far as getting a representative number of people who have the virus? Do we need more testing or a lot more? We know that we do not know of all the negative tests. We know there's a backlog of negative tests out there, and so that number of 2,700 probably is an underestimation, but we always want to have enough tests available for the people who are symptomatic to get tested. So yes, we are still hoping to be able to expand testing and offer more testing around our community so that we can see what the virus looks like throughout our community, not just in those that have prioritized testing, which are people who are sick, who have immunocompromising or underlying conditions, who are healthcare workers, or who have no other explanation for their illness. So yes, we always need more testing. What role does Dr. Eichhold or the health department play in the process of reopening our community? And we are operating under unified command with the mayor's office and the county commissioner's office. Along with Dr. Eichhold, those three principals and their staff are meeting daily and making decisions like the one that Dr. Eichhold announced today about strongly recommending the wearing of masks out in the community when you have to be out. Let's see, so next, what is the reaction to coronavirus outbreak at one of our long-term care facilities in town? Do you think it will have an effect on the rest of the Mobile area? So there were reports last night and a press release from Crown Healthcare of Mobile that they have cases in residents there and have had a few deaths. I talk with them every day, sometimes several times a day. We've been assisting through providing advice, locating personal protective equipment to take to them when they need it most. We are very hopeful and optimistic and trust that that situation is contained. And after speaking with them today, there's also some reason to hope that they will begin to start returning to normal. So I have no reason to think that's going to spill out into the rest of the community. Here is a question. Is COVID in the air? I get this one asked for a lot of different directions from time to time. If it's not in the air, why are so many people affected around the world? If it started in China and, it must be in the air. So the question of the answer to that question really is that COVID was in the air in the lungs of humans, and humans traveled all over the world. I mean, you can get from here to the opposite side of our planet in a day and a half. And with so much international travel coming out of China and into other countries freely, unchecked and unfettered, that's how it moved around the globe. It didn't move around the globe in air outside of humans. It was inside their respiratory systems, and then the humans carried that virus out of China and around the world. Let's see, here's another one. This one is about the mask order that Dr. Eichhold just read, and let me just read it to you here. To protect the health and safety of all residents threatened by COVID, it is ordered effective in Mobile on Friday at 8 a.m. that all essential retailers, as defined in the paragraph of the governor's original order on April 3rd, including grocery stores, pharmacies, and big box stores, shall comply with the following rule in addition to any other applicable provisions of the April 3rd order. Strongly recommend all employees and customers wear protective face covers, including bandana, cottage industry masks, and when engaged in any and all retail operations. Certified medical masks should be avoided unless ordered by a physician. This order shall remain in place as long as the state health officer order amended April 3rd remains into effect. So again, this is everyone working at a retailer, grocery store, gas station, pharmacy, home goods, home improvement store, everyone working there and everyone in that establishment should wear some sort of cloth face covering. And the other question from this newspaper was about a rumor that we may be considering further reductions in those stores, but there has been no recommendation to further limit beyond 50% the amount of staff or patrons that can be in any one given store. Remember, you still have to allow for people staying at least 6 feet apart and not congregating in areas of the store. So this is really important. And now with the addition of the order that strongly recommends a face coloring for all retailers, both workers and patrons, and we hope that that will continue to provide protection to our most vulnerable community members. We have been optimistic this week that, we saw initially a major increase in the number of cases reported daily when we saw testing become more widely available in the county. So I think yesterday I probably showed you this column chart that, last week, last Wednesday, Thursday, Friday, we really had tons of cases reported. It was 71 one day, 64 the next, and then 70. But since then, we've tapered off and we've been more in this sort of 20s to 50 range. And that's very encouraging that some of the social distancing and stay-at-home orders and curfews may be having the effect that we intend. But remember, we're not out of the woods. We know, or we have been told by some smart scientists with prediction models that the peak may hit Alabama around the 20th, so that's another 5 or 6 days. And at that point, we will just be halfway. And we still have, half of our curve to go. So please don't get complacent and staying at home and honoring or obeying to those stay-at-home orders and all of that social distancing when you have to be out. And having said that, we recognize that staying at home and, having disruptions to your normal lifestyle and your normal work lifestyle can be difficult. It can cause anxiety and stress. And we want to invite Virginia Gordon here to tell us how we can better mitigate those things in our lives. So thank you. We'll talk to you tomorrow.
Hello everyone, my name is Virginia Gordon and I'm the Clinical Behavioral Health Administrator here at the Mobile County Health Department. I'm also a licensed professional counselor, and we right now are providing telehealth counseling to many of our patients. One thing that I've heard a lot of is people not only with underlying mental health conditions, but also people without mental health conditions dealing with a significant amount of stress, anxiety, and even depressed mood. A lot of these people had different coping skills that now with these social distance regulations they no longer can access. That might have been having lunch with a friend face to face. That might have been going to work and being busy and getting their work done as a coping skill. That might have been going to the gym. So as you can see, a lot of ways people coped with emotional, psychological distress. They cannot cope that way anymore. So today I'm here to, one, acknowledge that and say that this is definitely a state of crisis, not just for physical health, but for many people, mental health. I'm going to give you a couple of tips to help you help yourself. One, be aware of your basic needs. This involves drinking water throughout the day, getting 7 to 8 hours of sleep, asking for help when you need it. During a state of crisis, you have to be in touch with your body, and this will help you think better and more clearly. Secondly, build self-awareness. A lot of symptoms of anxiety and depression they come up physically. For example, You might find yourself more agitated than usual, snapping at a family member. Possibly you're waking up with a mental fog. You find it very hard to concentrate. All of these are physical symptoms, but they reveal that you're struggling psychologically with anxiety and depression. So build that self-awareness, because once you do, then you can see, wait a minute, I need to do something about this. At this point, I encourage you to cope in healthy ways. Sometimes that means being creative. I have one patient that she has joint problems. You know, she can't take a jog on a treadmill, but she can go outside in her yard, she can walk around, she can use her light hand weights, and that movement will do wonders for her. I recommend 20 minutes of physical activity a day. This will help you clear your mind and focus on what you need to focus on. Other healthy coping skills include talking with a trusted loved one. There is healing power when you feel that your voice is heard and somebody hears you and loves you and cares about you. So remember that. Simply taking a hot shower or a bath helps. It has been shown that this helps reduce stress. And think of other ways that might help you personally. That might be listening to music. That might be engaging in an adult coloring book or just doodling. That also could be journaling. One thing that I share with my patients is try it out. Try out journaling. It basically helps what gets that is all stuck up in your head out on some paper. I want to conclude with some tips for relationships, because many of us are quarantining with our closest loved ones. And sometimes we don't treat our loved ones very well. And it's even more likely to do that with the people that you love the most. So first of all, remember that you all want the same thing. Remember that you're on the same team. Everybody wants peace in the home. Secondly, if you have problems, try to talk about them when the emotions are running low versus when the emotions are running high. Spend quality time together. Much research has shown that you pretty much build a savings account within when you spend quality time that's positive with your family members. This can then help you deal with adversity in a healthy way. Turn off electronics during dinner. This will help you listen to one another, hear one another, and minimize that distraction. That mindfulness in paying attention to what your family members say will make the world of difference. And remember, like I said earlier, if you're genuinely listening and the other person knows you care about them, that is a healing power to help them. And then a final tip is practice gratitude daily. There is so much research about practicing gratitude can help build not only relationship satisfaction, but quality of life. So I recommend that with your family or with your spouse, list 3 things that you're grateful for today. That might just be that you finally got a good night's sleep last night. Regardless of what it is, try to find things that you can be grateful for. I'm going to conclude with that, and please just be aware that we will be giving another video on more ways to persevere and to cope with this adversity. I have some things in mind that is basically from positive psychology and using your own character strengths to get you through hard times. Remember, you are not alone, and there are people that care about you. I'm going to conclude in stating that for some people, suicidal ideation is rising. So for those people, I felt it necessary to remind you of the Suicide Lifeline, which is 1-800-273-8255. There's also a crisis text line that you can text and be connected with a mental health professional 24/7. That's 741-741. And then finally, you can contact Behavioral Health Administration at 251-410-5772. If you're a patient and you want to get connected with behavioral health, you can also call our medical triage line at 251-690-8978. I hope everyone has a great Wellness Wednesday, and thank you so much for your time.
Thanks for joining us here on Fox 10 News. Now, we just heard from the Mobile County Health Department. We did hear from Dr. Eichel. He did say that he signed a health order that highly recommends that retail consumers and providers to wear face coverings anytime you're in that essential business. That will go into order Friday morning at 8 a.m. Again, this is just highly recommended that everyone working for a retailer, or maybe you're going to get groceries, that you wear a face covering, whether that be something you made homemade or a bandana. Also, we heard from Dr. Murphy. She says about 10% of patients that are diagnosed with COVID-19 in Mobile have been hospitalized. That means 90% have mild symptoms or are recovering at home. Also, the death rate in Mobile is about 2.5%. That's similar to Jefferson County and surrounding areas. Now, you can watch this full press conference in its entirety on our YouTube page.